Caring in Nursing Practice, Chapter 7. Nursing is closely related to the core of caring for our patients in both their health and their illness. Caring is central to the nursing practice, but it is even more important today in the high-tech healthcare environment, where the productivity as well as the efficacy can interfere with the nurse's capability and capacity to be caring and compassionate professionals. It is important to maintain a relationship-centered approach to patient care for all aspects of nursing, whether the focus is on pain management, teaching self-care, or providing basic hygiene measures. Caring relationships require sincerity, presence, availability, as well as engagement. The American Organization of Nurse Executives describe caring and knowledge as the core of nursing, with caring being a key component of what the nurse brings to the patient experience as well as the nurse-patient relationship. Caring is a universal phenomenon that influences the ways in which people think, feel, and behave in relation to one another. Personal concern for another person, event, or a thing provides motivation and direction for people to care. Through caring, nurses are able to help patients recover when facing illness, give meaning to their illness, and maintain or establish a connection. Madeline Leininger, who has the transcultural view of caring, describes the concept of care as the domain that sets nursing apart from other healthcare disciplines. Care is an essential human need. Care helps an individual improve the human condition. Acts of caring are nurturing and skillful activities, processes, as well as decisions that help people in empathetic, compassionate, and supportive ways. A caring act depends on the needs, problems, and the values of a specific patient. According to Jean Watson, caring is a central focus of nursing, and it is integral to maintain the ethical and philosophical roots of the nursing profession. Watson's theory of caring is a holistic model that supports a nurse's conscious intention to care to promote the healing and the wholeness of the individual. It integrates the human caring processes with healing environments, incorporating the life-generating and life-receiving processes of human caring and healing for nurses as well as their patients. The model is transformative because the relationship influences both the nurse and the patient. Kristen Swenson developed a theory of caring. This includes 5 caring processes, and it defines caring as a nurturing way of relating to an individual. The theory guides nurses in developing useful and effective caring strategies that is appropriate for multiple age groups and healthcare settings. Caring is central to the nursing phenomenon that is not unique to our nursing practice. It does improve patient satisfaction and outcomes. When reading through this case study, determine the challenges that you believe will be ahead for Mrs. Levine. Caring theories are valuable when a nurse assesses patients' perceptions of being cared for in a multicultural environment. Caring is relational, and in a healthcare setting, the nurse and patient enter into a relationship that is much more than one person simply doing tasks for another. In a caring relationship, a mutual give and take develops as the nurse and patient begin to know and care for each other. One specific aspect of caring is enabling, when a patient and nurse work together to identify alternatives in approaches to the patient's care and their resources. Another common theme of caring is understanding the context of a person's life and their illness. Continuing with the case study, after thinking about what we have found out so far, what do you think Jim's relationship and interaction will be with his mother in the weeks to come? Caring is an invaluable part of the art of nursing. The Caring Assessment Tool, or CAT, was developed to measure caring from a patient's perspective. This tool, as well as other caring assessments, help the nurse, as a beginning professional, to appreciate the type of behaviors that patients in the hospital identify as caring. When a patient senses that healthcare providers are sensitive, sympathetic, compassionate, and interested in them as people, they usually will become an active partner in the plan of care. Building a nurse-patient relationship to learn what is important to the patient is integral when caring for our patients. Caring is considered an interaction between the nurse and the patient in an atmosphere of mutual respect and trust. This is a collaborative environment where the nurse provides encouragement, hope, support, and compassion to help the patient achieve their desired outcomes. This is a professional and an ethical covenant that nursing has with the public. Caring science provides a disciplinary foundation from which the nurse delivers patient-centered care. Nurses that function from an ethic of care are sensitive to unequal relationships that lead to an abuse of one person's power over another, whether it is intentional or not. An ethic of care places the nurse as the patient's advocate, solving ethical dilemmas by attending to relationships and giving priority to each patient's unique individualism. Considering the case study and the way it is unfolding, how important do you believe Sue's initial meeting and interaction with Mrs. Levine will be? What clues are presented that Sue is conscious of the importance of this first meeting? As a nurse, it is vital to assess both your caring needs and your caring behaviors. A nurse must recognize the importance of their self-care. A nurse cannot fully engage in compassionate care when the nurse feels depleted. That is why it is vital that the nurse engages in their own self-care. The nursing practice, as well as patient satisfaction, improves when nursing presence is part of the healthcare culture. Presence is an interpersonal process that is characterized by sensitivity, holism, intimacy, vulnerability, and the adaptation to unique circumstances. It results in improved mental well-being for the nurse and patient, and improved physical well-being in the patient. The nurse uses presence in conjunction with other interventions, such as the nurse-patient relationship, providing comfort measures, patient education, as well as active listening. The outcomes of nursing presence include the relief of the patient's suffering, a decrease in the sense of patient isolation and vulnerability, as well as the nurse's professional growth. The nurse enters the patient world, and the patient is able to identify feelings and solutions, see new directions, and make choices. When the nurse establishes presence, eye contact, body language, voice tone, listening, and a positive and encouraging attitude act together to create openness and understanding. Establishing presence enhances the nurse's ability to learn from the patients. This includes their hopes, dreams, their need for support, and their expectations of the care. When a nurse learns from a patient, it strengthens the nurse's ability to provide adequate and appropriate nursing care. Continuing with the case study, how do you think the initial interaction between Sue and Mrs. Levine is going? What are 3 things that Sue has said or done in the initial meeting that indicate how her nursing care will be a positive and an integral part of Mrs. Levine's patient's care? The use of touch is one comforting approach that reaches out to patients to communicate concern and support. Touch is relational, and it leads to a connection between the nurse and the patient. It involves contact and non-contact touch. Contact touch involves obvious skin-to-skin contact, and it is often referred to as therapeutic touch. Before implementing touch, the nurse needs to be aware of the patient's cultural practices as well as past experiences. Non-contact touch refers to eye contact. It is often difficult to separate the two. Both will provide a connectedness between the nurse and the patient. The nurse will use task-oriented touch when performing a task or a procedure. The skillful yet gentle performance of a nursing procedure will convey security and a sense of competence. An expert nurse learns that any procedure is more effective when it is explained and administered carefully and in consideration of the patient concern. Caring touch is a form of nonverbal communication, which successfully will influence the patient's comfort and security, enhance their self-esteem, increase the confidence of the caregiver, and improve the patient's mental well-being. Protective touch is a form of touch that protects the nurse or the patient. A patient may view it either positively or negatively. The most obvious form of protective touch is in the prevention of an accident. Protective touch may also protect the nurse emotionally. Because touch will convey many messages, it needs to be used with discretion. Touch itself is a concern when crossing cultural boundaries of either the patient or the nurse. A female patient has just found a large lump in her breast. The physician needs to perform a breast biopsy. The nurse helps the patient into the proper position and offers support during the biopsy. The nurse is demonstrating, enabling, comforting, a sense of presence, maintaining belief. The answer is C. Providing presence is a person-to-person encounter, conveying a closeness and a sense of caring. Presence involves being there and being with. In the case study, as Sue prepares to administer the chemotherapy, What are 3 ways that she can demonstrate to Jim her caring for Mrs. Levine? Active listening is necessary for meaningful interactions with patients. This is a planned and deliberate act in which the listener is present and engages the patient in a non-judgmental and accepting manner. The nurse takes in what a patient says, interpreting and understanding what the patient is saying, and then gives back that understanding to the patient. Active listening to the meaning of what the patient says helps create a mutual relationship. True listening leads to knowing and responding to what really matters to the patient and their family. To listen effectively, the nurse needs to silence themselves and listen with an open mind. They need to remain intentionally silent and concentrate on what the patient is saying. The nurse needs to give the patient their full, focused attention as the patient tells their story. Through active listening, the nurse begins to truly know the patient and what is important to them. Learning to listen to a patient sometimes may be difficult. Active listening involves paying attention to the individual's words, tone of voice, and entering their frame of reference. Knowing the patient is a complex process that occurs over time and within the context of the nurse-patient relationship. It is an essential element of nursing practice, and it is linked to patient satisfaction and successful outcomes of care. Through caring, the nurse develops an understanding that helps them to better know the patient as a unique individual and choose the most appropriate and effective nursing therapies. A caring relationship, coupled with the nurse's growing knowledge and experience, provides a rich source of meaning when changes in a patient's clinical status occurs. Expert nurses develop the ability to detect changes in patients' conditions almost effortlessly. The most important thing to do for a beginning nurse is to recognize that knowing a patient is more than simply gathering data about a patient's clinical signs and symptoms. The definition of maintaining belief is sustaining faith in another's capacity to get through an event or transition and face a future with meaning. The subdimensions for maintaining belief include believing in and holding in esteem, maintaining a hope-filled attitude, offering realistic optimism, and going the distance. Based on Swanson's theory of caring, what might be an appropriate response on Sue's part in maintaining belief? An individual's personal beliefs and expectations will affect their own physical well-being. Establishing a caring relationship with a patient involves interconnectedness between the nurse and the patient. This interconnectedness is why Dr. Watson describes the caring relationship in a spiritual sense. Spirituality offers a sense of connectedness, intrapersonally or connected with oneself, interpersonally connected with others and the environment, and transpersonally connected with the unseen, God, or a higher spiritual power. In a caring relationship, the patient and the nurse come to know one another so that both move toward a healing relationship. Reducing symptoms and suffering requires patient-centered caring actions that give a patient comfort, dignity, respect, and peace, and that also provides comfort and support measures to the family and friends. Through skillful and accurate assessment of patients' symptoms, the nurse's delivery of patient-centered care will improve the patient's level of comfort. Human suffering is multifaceted, affecting the patient physically, emotionally, socially, and spiritually. It also affects the patient's family, caregivers, as well as other family members. Caring for an individual includes the person's family. As a nurse, it is important to know the family and the caregivers as thoroughly as the nurse knows the patient. The family is a vital resource. It is crucial that a nurse ensures a patient's well-being and safety and helps the family to be active participants. Begin the relationship by learning who makes up the patient's family as well as their roles within the patient's life. Caring is the heart of a nurse's ability to work with people in a respectful and therapeutic manner. Caring is specific and relational for each nurse-patient relationship and encounter. For caring to achieve cure, the nurse needs to learn cultural specific behaviors and words that reflect human caring in different cultures. Because illness is the human experience of loss or dysfunction, any treatment or intervention given without consideration of its meaning to the individual is more likely to be worthless. Caring involves a mutual give and take that develops as the nurse and patient begin to know and care for each other. It is difficult to show caring to individuals without gaining an understanding of who they are and what their perception is of their illness. Presence involves a person-to-person encounter that conveys closeness and a sense of caring that involves both being there and being with the patient. Research has shown that touch, both contact and non-contact, includes task-oriented touch, caring touch, and positive touch. The skillful and gentle performance of a nursing procedure conveys security and a sense of competence of the nurse. Listening is not only taking in what the patient says, it also includes interpreting and understanding what the patient is saying and giving back that understanding. Knowing the patient is at the core of the nursing process that the nurse uses to make clinical decisions. What should Sue do to show her caring for Mrs. Levine? When a nurse enters a patient's room and says good morning before starting care, the nurse combines nursing tasks and conversation. An important aspect of care for the nurse to remember is the need to establish a relationship, gather assessment data, treat discomforts quickly, assess the patient's emotional needs. The answer is D. In Swanson's theory of caring, being with is being emotionally present for another person. By taking the time to assess the patient's emotional needs, the nurse is exhibiting caring behavior. The concept of caring actually motivates individuals to become nurses. When nurses commit themselves to be caring individuals, they achieve a meaning and a purpose in their life. Nurses can gain a sense of satisfaction when they know they have made a difference in their patients' lives. Nurses often are torn between the human caring model and the task-oriented biomedical model, institutional demands, and time constraints that will consume the nursing practice. If healthcare is to make a positive difference, it must become more compassionate. The nurse plays an important role in making care an integral part of healthcare delivery.